Hello, this is Dr. Gary Bellman. I'd like to explain some things about an enlarged prostate and how we approach and consider enlarged prostate, specifically surgical treatments. So basically, we as men are blessed with a prostate, sits around the urinary tract, and for some reason with age the prostate grows and restricts the stream, and the passageway becomes more restricted, and therefore we want to make the prostate look more open. And we have different options to do that. When we see men, and I'm going to use this Play-Doh model, took my grandkids shopping for their birthday, it made me think about this might be applicable. Now, some men have a medium-sized prostate, 50, 40 grams, but the aperture is pretty open and they're urinating fine. There's a lot of talk about shrinking. How do I shrink my prostate? Well, we really don't want to shrink the prostate. We want to make the passageway more open. And so the absolute size of the prostate is not as important as the passageway. This is a man with a bigger prostate. This is more of a 70-gram prostate, but you can see the aperture is pretty open, and as long as someone's urinating fine, intervention is not necessary. What happens when we see men with an enlarged prostate, but the aperture is narrowed? Some men choose to have the prostate operated on, and the treatments that we have available to us, one is a standard TURP. TURP is essentially we take this passageway and we want to open it up. And this is an example of opening up the prostate where we carve out a channel, and this will make the prostate and some of the chips, and this happens during surgery, some of the chips open up and we make the prostate more open. There are side effects, namely sexual side effects. This has to do with TURP, green light laser. What happens if we have an even larger prostate? We have newer treatments like aquablation, where we can manage larger prostates, and still we are taking and carving open the inside of the prostate and taking tissue and opening it up. It's a surgical procedure, has to be hospitalized, risk of bleeding. The end result is good, and we take a channel and that's open. The absolute prostate is really not shrinked as much, but the channel becomes more open. So we have ablative therapies where we destroy tissue and open up the channel. TURP is the conventional one, green light laser. They are effective, but of high risk, what's called retrograde ejaculation. Then we have the aquablation and resume. They have lower chance of retrograde ejaculation, but still a chance. If we see patients who say, Doc, I want to urinate better, I want a treatment, however, I don't want to accept this retrograde ejaculation, then we look at something like a urolift. And a urolift is we have a narrow channel, but we don't want to destroy it. So essentially, we're taking these little stents and pinching open the prostate in a number of little positions where we're not destroying tissue, and it has no sexual side effects. But at the end, the channel is open, very similar to the TURP. So if you're considering a treatment for an enlarged prostate, the first question is to discuss with your urologist your tolerance or your concern about accepting these sexual side effects, specifically retrograde ejaculation, where the fluid goes back inside and nothing comes outward during sexual activity. This is very common to happen with a TURP or a green light laser. Less common with aquablation or resume, but still common, and it doesn't happen with the urolift. So I hope this gives you an overview of how to manage an enlarged prostate. It's not so much about shrinking the prostate, but it's opening the passageway. And then if you have this problem, try to find the right solution to your problem. Thank you very much, Dr. Bellman.